It's Health View on your talk station, News Talk 640 WFNZ.
And welcome back to Health View. This is Dr. Angela Ruff, and again, our guest this morning is Dr. Wendy Jones, who's an OBGYN with Women's Wellness Center. And again, if you guys would like to call for more questions or even make an appointment, their number is 323-3301. Again, Dr. Jones, thank you so much for taking time out of your schedule to give us some great information.
Thank you for having me, Dr. Ruff.
Well, this is good. Now, okay, I've got a basic question for you. When do you know, and I'm kind of going through this perimenopause stage, when do you know when you've finally gone through the menopause? When is it safe to have sex and not worry about getting pregnant?
Well, the average age of menopause in this country is 51. The definition of menopause, to be truly menopausal, you have to be without a menstrual cycle for 1 year.
1 year.
1 year.
Okay.
If you are in that perimenopause time, you need to continue to be careful because you can have breakthrough ovulations. If you have any concern about whether you may be menopausal, you can go to your OBGYN and they can, there is a blood test that can be done to check your hormone level. That's called an FSH level, and there are certain times in the month that you could draw that, and it would be more accurate for telling whether someone would be menopausal.
Right.
But officially, if you have been without a menstrual cycle for a year, you can consider yourself menopausal.
Okay. So after age 51, maybe you don't have to worry about birth control anymore.
Yes. If you've been without your cycle.
If you've been without
your cycle for 1 year.
I hear you. Okay. So those are the two
caveats there.
Yeah. All right. Got it. So speaking of birth control, maybe you can give us your opinion on the different birth control that is available, and what's your opinion on what's perhaps the best type, I guess, based on the age or your circumstance?
Okay. There are lots of different forms of contraception that are available. The most typical forms that people are familiar with are certainly oral contraceptives that have been around for a long period of time. I think one thing that I do find frequently, I'll have a patient that'll come in and say, no, I'm not interested in an oral contraceptive. I was on that when I was 15, and they'll be in their mid-30s, and they'll say that they don't tolerate oral contraceptives. I would encourage you to give those a try, or be open-minded at least, because certainly they've come a long way in the past 15 years, and they are much lower dose pills than they were previously.
Okay.
Because with research we found that it does require a relatively low dose for many women to suppress their ovulation. Other forms of contraception, there are hormonal patches that are available. Those have received some attention recently in the media because of increasing your risk for developing a blood clot. That risk, however, is not as much as the risk of clot development if you had an unplanned pregnancy. So pregnancy is the thing that increases your risk of developing a blood clot more than anything else. So for some women that would still be a safe alternative, especially if they're forgetting their oral contraceptive on a daily basis, because the patches are once a week.
Right.
The other options, if someone is in a monogamous relationship, or especially if they've just had a baby and say they're trying to space pregnancies, an intrauterine device is a very effective form of contraception, and that's something that you don't have to remember to take on a daily basis.
Right. Is that, I've heard that can be painful. Is that just the old type? I guess it's improved some over time.
Years ago, when the first intrauterine devices came out, there was the whole issue with the Dalcon Shield, and those were not as safe as the newer options that have been available, say, in the past 10 to 15 years.
Right.
And more recently, there are some low-dose hormonal products that are 5-year devices that patients are very, very happy with. There's a 5-year IUD, and then there's more traditional 10-year IUD.
Wow.
The 5-year device has a low dose of progesterone, and with time that can make you have amenorrhea, which means that you would actually not have your menstrual cycle. And for most women, that's pretty nice option.
Plus, yeah, and that's what's I've read about is the low dose pills that you just keep taking to avoid your period as well. Is there a pro or con about that? It just seems like there's only pros with that.
As long as we know why your period has gone away, it is safe for you to not have your period. And so a lot of women are choosing contraceptive measures so that they can do that, so that they can either there's a oral contraceptive that's on the market, Seasonique, so that you would only have 4 periods per year. And professional women have, even though that's a relatively new product, professional women have been doing that for years, have been manipulating their birth control pills to postpone their menses. And so I think that's a safe option for patients, and it certainly makes lifestyle a lot easier. Sure,
Definitely. With these new low-dose estrogen, do you see, I've heard commonly said that, well, gosh, if I'm on birth control pills, then I'm going to gain weight. Is there still that risk of gaining weight because of the low-dose estrogen versus the traditional ones that they used to be done 20 years ago?
They are much better than they used to be, I can't tell you that, with an oral contraceptive, in theory, with the low dose of estrogen, you can have a couple of pounds of water retention. But there have been studies that have been done on some of the lower dose pills that show there really is no significant weight gain with an oral contraceptive. So that's not really a valid argument as much anymore as it was years ago.
And if you get pregnant, you probably gain more than 2 pounds.
Absolutely. Absolutely.
You'll definitely show a lot more than that water retention. Now, isn't there also a shot or an injection that's available too?
There is. I'd forgotten to mention that. Depo-Provera is an injection that you would receive once every 3 months. The nice thing about that is that it's only once every 3 months, so that takes some of that worry out of it and some of that having to remember out of it.
Sure.
The drawbacks to Depo-Provera are that we do know that progesterone does stimulate your appetite. And so I do frequently see patients that have significant weight gain with being on that. It's not so much that the hormone makes them gain weight, but the hormone makes them feel hungrier. And so they will eat more and therefore gain weight. So if patients choose that as their contraceptive measure, I'm always careful to tell them, make sure you're not eating more than your normal. It won't make you fat, but it will increase your appetite if you're not careful.
Right. If you find yourself wanting an extra helping,
that's right. You gotta watch out.
Just know it's your mind playing tricks on you. Okay. So then, of course, I guess there's just the. Now, I've heard a friend of mine talked about like the rhythm method. Is that even effective? I mean, she has a few babies from that method.
You really have to be very aware of your body if that's the method that you choose to use. And even with having that keen awareness of your body, I think that it would be really important to be cautious at the time that you become perimenopausal, say in your 40s, because that's a time that people will frequently have accidents on the rhythm method when their ovulation suddenly, it used to be that it was their cycles were every 28 days. Well, suddenly they'll space and their ovulation will be a little bit off, and they might not be aware of that change, and that could be where they could have an accident. And so they would need to be cautious, very cautious, if that's what they're choosing to do.
Right.
Certainly would not necessarily be one of my recommendations for them to try that.
Yeah, sure. Especially when there's so many other safe methods out there. Now, what is your opinion about women using the Seasonique or something low dose like that, estrogen pills, to help with perimenopausal symptoms like hot flashes and things like that?
That's a great question, and I do have lots of patients that choose to stay on their low-dose birth control pill through the perimenopause, and it does effectively, frequently control their symptoms, as long as they have no risk factors for doing that. And the predominant one that comes to mind would be tobacco abuse. Certainly, if they're a smoker, and they're over the age of 35, we know that that would increase their risk for a blood clot. But if they're otherwise healthy, they're a non-smoker, they're not hypertensive, they don't have obesity or other medical problems, and this has been a pill that they've known to have good results with them, then they can continue that through the perimenopausal period.
Right, right. Well, that's good to know. So it could be used for many uses.
Absolutely.
So that's great. We asked you earlier, but in fact, I had my mammogram at y'all's lately, and I was reading the handout where it was talking type of machine that y'all use 3D almost to evaluate the mammograms. Maybe you can talk a little bit about that.
Sure. We do have the ability now to enhance our mammogram with 3D imaging. That tends to help patients that have more dense breast tissue, and it does increase the sensitivity of the detection of breast cancer by that mammogram. I don't have a specific number for you.
You can make up something there.
Anything that improves our detection of breast cancer is going to be important. The biggest thing to remember is the importance of getting your mammogram.
Sure.
Whether it's the traditional form or the 3D enhanced mammogram, just remember to go. And if you have a family history, you should begin that usually about 5 years sooner than the earliest relative is what I recommend to patients, or age 40. Begin having your mammograms.
Okay. Now, how about women who've had breast implants? Is it still safe for them to have a mammogram?
It is safe for them to have a mammogram. If they had some risk factors for breast cancer, say they might have a family history, or they had some area that they were concerned about, breast MRI might be a more effective means of detecting something in someone that has an implant. Patients that have breast implants or are looking to have that surgery frequently will recommend that they go ahead before their surgery and come in to get a baseline mammogram so that we have that information on file, what the breast tissue typically looks like before the implant gets placed.
I see.
So that we have that for comparison later on.
Right, sure. I was reading in the Mayo website about this, and they were comparing their study with the MRI mammograms and this new 3D mammograms, and they found that the detection of breast tumors or pathology was comparable from the MRI versus this new 3D mammogram. So I think that's really exciting that this is available in Fayetteville. And, y'all are just right on the cutting edge of helping us, yeah?
Well, thank you. We hope so.
Yeah. So that's good to know. Some of the other, maybe I'll just get your opinion on maybe some of these other birth control methods. The diaphragm and the contraceptive sponge, how effective are those versus the other methods you mentioned earlier?
Those are not nearly as effective as the previous options that we mentioned, and frequently we really just don't see that we use those anymore or recommend those to patients. Diaphragms would have to be fitted by a gynecologist, and I really don't know of anyone recommending that as a contraceptive measure at the present time, because the caps can slip and you have patients that can have accidents with those. And the sponges are not as effective as some of the other means, and so those are two forms that we traditionally just don't use anymore.
Right. Well, it sounds like there's so many other methods available that are almost less invasive and easier to tolerate.
And there are, and there was one, I just realized there was one method we didn't mention, and that there is a ring called the NuvaRing that is also available to patients. That is something that is a small ring device that releases low-dose hormones. The ring is placed into the vagina by the patient, and that is changed once a month.
Okay.
And so if you're having trouble remembering to take your pill every day, then that's a nice option for you. At least if you always place it on the first of the month, then that would be easy to remember.
Do you still have your period
You do.
with that? I'm going for the pill method. That sounds like a better deal.
Pushing it out.
Yeah, that's
Or the
right.
IUD.
That's
IUD
right.
Make it go away also.
There you go. Two good ways to make it go away. Well, you've been listening to Health View, and this is Dr. Angela Ruff, and again, our guest this morning is Dr. Wendy Jones, who's an OBGYN with Women's Wellness Center. Their office number again, do you mind sharing that?
323-3301.
Great. So 323-3301. So if you have any questions or if you'd like to make an appointment, feel free to call them. This is News Talk 640 WFNC.